Welcome to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon in the studio with me, I have Paula Taylor. And I know it is the McGrane Center, but Paula, tell me the long word of what the McGrane Center is really called.
It's the McGrane Center for Health and Wellness. I'm a physical therapist, so in that building, it's also Kootenai Health Outpatient Rehab Services.
There's lots of things located in that one little building over there.
Yes.
So let's talk about what is at the center. Tell me the different things that are there, because there's a whole lot of different services that are provided at McGrane, and it would probably take hours and hours for us to talk about them all, but tell me what's over there.
There's the Adult Day program, and that program is run by Social Services at Kootenai Health. There is a pool, a therapeutic pool, which is 92 degrees, 24 feet by 48 feet. And then there are the outpatient rehab services programs, which are occupational therapy, physical therapy, and speech therapy. The Adult Day program phone number is 666-2728. The pool phone number is 666-3858. And for outpatient rehab services, that phone number is 666-2950. The other unique thing we have at the McGrane Center is we do treat from a very, very young age to as long as somebody's on this earth. So we have a very strong pediatric program that treats kids, and then we treat adults through 100, 101. So we're able to cover the continuum along with offering the water and the land as options for therapy.
Well, let's start with one little piece, the Adult Day.
Okay.
I know that in the Adult Day Center, it's a place where if you've got a senior that is maybe having some cognitive difficulties and you're caring for that person at home and you need to do things, you need to go to the store, you need to go to work, whatever, that you can bring that loved one there, and they're in an atmosphere of with other folks. They provide activities for the seniors. They provide, is it a meal or a snack in there?
Correct.
For them?
They that program is there for respite for the care providers. I think both breakfast and lunch are provided. There's snacks provided. There's rest periods provided. There's also singing and dancing, cards. Usually there's a project or two.
So it keeps them occupied.
Right.
And I know that from talking to some of the folks over there, they accept long-term care insurance benefits, and they also accept VA benefits, so that if you have a loved one who does have long-term care insurance, that they can use part of that policy for their care there at the Adult Day. And also if they're a veteran through the VA health system, that the VA will pay for their care there. So those are some options if you're caring for someone at home and you really need some time to yourself. The Adult Day is a great way to go, especially if you're working with someone with dementia. It can be very taxing on the caregiver, and that is a great way to give yourself a rest. One of the other things is the pool that's over there. Now, I have been there. I have taken folks to that pool, and that is really a neat place.
That pool is a gem. We waited for a long time to get that pool as part of our therapy program, and Festival of Trees for 2 years supported the building of that pool. So we thank the community every day for that. It is a large pool, 48 by 24. It has a handicap lift. It is 92 degrees.
And meaning a handicap lift if someone is in a wheelchair.
Right.
It's just another seat they scoot over into, and it lifts them up and puts them down in the water.
Yes.
So there's no excuse why you can't go to the pool.
Right, right. There is There are a couple programs we try to do in the pool to keep it active. We have exercise classes, and if you go on the website kootenaihealth.org and click on the pool, the aquatic therapy site, it'll give you a pool schedule which changes every 3 months. So we have exercise programs that are taught by certified aquatic instructors, and those vary from level 1 to level 3+. They're offered throughout the day, but for most folks that are going to be using it, we offer arthritis and the lower level classes from the hours of 10 to about 3. So 11:30, 12:15, there's a 4 o'clock class, there's a 10 o'clock class. Then we have an independent program where if you've been to physical therapy and they've taught you what to do, or you just want to do your own workout, you can come in pretty much any time during the day and perform your own exercises using our equipment. And then we have the skilled physical therapy that happens, and that's when the therapist is with the patient working on particular skills.
And I have seen the therapists there with people in the pool having them do different motions, that they're trying to strengthen or after an injury or something like that.
Right. The water, the thing that the water provides us as physical therapists is twofold. If we have a patient who's not able to put a lot of weight on an injured femur or foot that's been fractured or sprained, they can start their therapy much, much earlier because they're in the water and we can go in the deep end and there's no weight bearing. It helps athletes because they don't have that downtime until they're able to get back on their feet. They can get their cardio and a lot of their agility work done in the water. And then it's also available for people who, when they exercise on land, they just hurt. And this way they can get their work and not have that pain in their back or their knees. And then the other place that we'll use it quite a bit for is balance, because it's a fairly safe place to practice some walking without the fear of falling to the ground. So we can ask a lot more of the patient, and they're not so fearful of being injured.
I know a young man who is having to learn to walk again after an injury, and he was at the McGrane in the pool, and he was able to stand up and walk, which he couldn't do when gravity had something to do with it.
Absolutely.
And
different heights of the water will remove a certain percentage of your body weight, and depending on what we're working on, we'll either put them waist height or chest height, and it does give them quite a bit of freedom. We offer the pool to a lot of the pediatric therapists and also to some school programs for that same reason. It allows the child to move like they can't move with gravity, and it's very enjoyable for most of them.
And I always snicker when I look at some of the tools that you use. I mean, when you go into exercise in a gym, you have heavy weights and things like that. And when you go to exercise in the pool, it's a piece of styrofoam that you think, oh, this is nice and light and easy. But then when you go in the water and try to push that styrofoam down in the water, it's not so easy to do.
Right. You're fighting a couple things in water. You're working against a couple things in water. The buoyancy of the equipment, and so for our dumbbells, they're actually styrofoam, different sizes, so they're either easy to push down or hard to push down. We have rings that we put on people's feet, same idea, they have to push them down.
And it tries to lift them back up. Okay.
And then we also have people who are so buoyant, we have to put weights on their feet so they don't float up. So those would be the people that have been injured, maybe a spinal cord injured person or somebody who's very, very weak. If we don't put weights on their ankles, the legs will float up. So we use buoyancy and weight in a kind of a different way, almost a backwards way when we're in the water.
Yeah, it's really neat because, like I said, I've been there and watched some of the folks moving, and it's interesting to watch them when they're going into the pool. They're walking very slow, and it's very hard and difficult. And after they've been working in the pool for a while, it loosens up their muscles and their joints, it seems. And when they come out, they got a little bit more spunk.
Movement is critical to any joint at any age, and less weight bearing with that movement is a better idea as you get older or if you've had an injury. So the water, it's warm, you have less weight bearing, but you're getting all the movement, all the range of motion, and lubricating your joint capsules. So it's kind of a win-win for anybody who wants to do any kind of movement but can't on land, or just wants to alternate a little bit of land exercise with some water exercise for some, variability, so they stay motivated.
And you've always got someone there so that in case they get into trouble when they're in the water, there's someone there to help them out.
Right. We are not 100% lifeguarded. It has a sign that says it's not fully lifeguarded, but our aquatic instructors are there most of the day teaching classes, and when they're not there, we have somebody else stop in and watch the pool. So we do some instruction if we feel the person needs some instruction for safety. If there's some question about the individual's safety, they usually bring a caregiver with them, and then we instruct that caregiver on how to use the lift, how to use a gate belt for safety. So there are some expectations for safety as people enter the pool, and then if they become weakened to a point where they need a caregiver, that's usually a discussion we have pretty early on, so we don't have the accident. All of our people who work in the pool, as far as instructors, are certified lifeguards, so they're very aware of the potential for injury or something going wrong, and so we think ahead. But we also do a lot of pool training every year for all the staff.
And when you go in, I know there is locker rooms for men and locker rooms for women, and you've also got handicap dressing rooms that the caregiver can go in with the person to help them, take off their street clothes, put on their bathing suit, get ready to go in. And I really liked that there's enough space, that there's two of you there to help the person to get ready to go in the pool, and then once they come out, to help dry them off and get them safe.
Right. We have a lot of parents that bring their children in, and then a lot of caregivers. And when we designed the building, we wanted to make sure we had ample size for that, because that, of course, was the need, is the people who are in wheelchairs who need a second person helping them. So the first entrance off the hallway is the handicapped locker rooms, and there's two of them, and they have benches in the shower stalls. They have benches outside in the room. They have bars. They have a pull cord for an emergency. Everything is handicap height, and all the doors in and out, both into the handicap locker room and onto the pool deck, and then back out to the hall, are automatic. So the access is pretty easy for anybody who can't push open a door. Everything opens for them.
I always thought of that pool as being for seniors, but you've mentioned on a couple of occasions pediatrics. What percentage would you say of the people that, just of your observation, of the people that come in and utilize the pool for rehab are pediatrics?
On the independent side, where parents or caregivers will bring, and I'm thinking pediatrics would be 18 and under.
Right.
There maybe 5 to 10% of the independents are children who come in with a care provider or a parent. As far as the groups, a few of the kids will join one or two of the groups. And then when we get to the skilled therapy, where the therapist is with the patient, that may be a little higher. Maybe 15% of all the skilled therapy patients are with a pediatric therapist working on sitting balance or freedom of mobility or dexterity as far as their aim or things like that. So
I would think that would be something that would be fun. I mean, if you're going to have to go through therapy and exercise, doing it in the pool is not too bad.
You're right. I exercise on Tuesdays and Thursdays at the 415 class, and it's an awesome place to exercise. And I think with anybody, but especially the kids, you're always looking for a motivation, and that's pretty easy, the pool.
Well, and it's really neat, especially if it's really, I don't want to bring this on, but especially if there's a lot of snow out. You have that whole wall of windows, and here you can be sitting in the pool nice and warm and 92 degrees and look outside and watch the snow all piled up and listen to the music, and you're in this little paradise area where the rest of the world is covered in snow.
It's a beautiful building. We're very lucky to have it, and it is it's wonderful to be in that warmth when it's cold outside.
Now, one of the other rooms that you all have it's an exercise room. To me, looking at it, and it's an exercise room, but that is where a lot of the physical therapy goes on.
Right. That's the main gym. We have two gyms in the building. It's actually a very large building. It just doesn't look that big from the outside. We have an adult therapy gym and a pediatric therapy gym because the equipment is completely different. So the gym you're talking about is the adult therapy gym.
I didn't know you had another one. Oh,
further
okay.
down the hall, full of colorful balls and climbing walls and bolsters and rolls and bubbles, and it's just a very fun room for the kids.
I'd rather go there.
The adult room for the physical therapy and the occupational therapy is basically a big gym like you might see at an athletic club, but at least half of it is focused on what we really do there, which is working on balance, gait safety, so that if people are falling, we work on strengthening them so they don't fall. So we do have a lot of equipment that you may not see at a gym that is for skilled physical therapy. We have the treatment tables, so we can do the work with the muscles and the ligaments and the tissues. We have a lot of therapy balls. We have some steps that people can work on going up and down the stairs. We have some arm exercise machines. We have treadmills. We have a lot of foam and balance balls that people have to stand on to practice with their balance.
I'm not sure I could do that.
It's not a favorite. So there's a lot of things in that gym, but that's the adult-focused gym. And we also open that up to KMC employees, KH employees, at certain times of the day so they can get their workout in also by just coming across the parking lot.
Very interesting. Well, I want to take a break, but I want to continue talking about this because I've done a tour over there a couple times, and I thought I knew every room that was there, but I guess they kept the pediatric exercise room away from me because they knew I'd enjoy it too much. So we're going to take a break, but we're going to continue talking about the McGrane Center behind Kootenai Medical Center.
Okay.
And we'll be right back.
We probably want to talk about the lymphedema room. Lymphedema is a problem that occurs when you've had a cancer surgery and you have your lymph nodes removed, and you tend to swell up because the lymph system is compromised. And you see it quite frequently with breast cancer survivors.
Oh, okay.
We have that room. It's painted beautifully and a little bit different, more like a home. We have a kitchen there that we have.
Yeah, I
people
was going to talk
practice.
about
Okay.
the occupational therapy part.
Yeah, and then we have the driving room, and then we have the pediatric gym. So those are probably the big three.
Okay.
We have 3 certified lymphedema trained therapists: Stacy Davis, Wendy Stredwick, and Gail Garrett Anderson. And you have to have a referral. Yeah. Anybody.
I'm sorry. Go ahead.
No, I just.
And we have a satellite.
I'm new there.
We have a satellite in Post Falls at that cancer center where the girls go over there and do lymphedema treatment too, so the patients don't have to see a doctor in Post Falls and then
Drive over
drive in.
here. Okay.
Oh, I have one question too. If they are going to the McGrane Center for outpatient therapy, can they utilize the van?
Yes, I have that down here, but the van, yeah, I have MD prescription in most cases, but not always, and the van brings them to any, so as long as they have access, as long as they have room. The van is very, very busy. But when they can, what we do is we make a set of appointments, and then if the person needs transportation, we fax that appointment list over to the van service, and then the individual and the van service. And so many, I would say probably a good third of our patients come with the van.
Okay.
And somebody asked me once about utilizing the van. Do we have to fill out all this paperwork and answer a questionnaire and those kind of things?
I don't know, but I've not heard that from anybody.
Okay, I don't think so either. I think it's pretty easy.
You just have to be able to get down your steps and get into the van. They can't carry you,
Right.
but they have wheelchair lifts.
But then the caregiver can ride along.
Absolutely.
Okay.
And then is there cost associated with if you're going in to work out?
Yeah, yeah. So we probably need to talk about that, but we give the caregiver a free pass when they come in for the community programs and the classes. There's cost for both those.
And I know that when the caregiver is in the pool helping the person, there's no cost.
Right, they come for free.
Yeah.
Absolutely.
Okay. Let's continue on. Too many things. I told you we could talk for hours. Okay, you okay? Okay. And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Paula Taylor with the McGrane Center and lots of other words, outpatient rehab.
Right.
And we were talking about the room with all the exercise equipment, and she had told me that there is a pediatric room also. Now, if you want to utilize either one of these rooms for therapy, you need to get a referral for physical therapy from your doctor?
The skilled therapy that's provided at McGrane can be done in the water or on land with any age group. And with the skilled therapy, whether it's physical, occupational, or speech, you need, in most cases, a prescription from your doctor. That is usually paid for by your insurance, but of course every insurance has limitations. Once you're through with the skilled part and you're on a maintenance program, then your opportunity is to go to the pool and do your own thing, or go to the pool and do the classes, and there's a cost to that. and that is $50 for 12 visits. We get you a punch card that you can use over 3 to 4 months. So if you are away or you get sick, you're not penalized. The other thing that we offer is if you've come through physical therapy in the gym, you can stay there and work out on the equipment since you've been working on it before and you're familiar with it, and we're around to help you with your questions, and that is a different price, but you can also buy a punch card for that. So we allow the community, after they've been discharged from therapy, to come in and do their own thing, either in our gym with our equipment or in our pool. The pool is just way more utilized for that than a gym.
And you had mentioned something during the break. When we started talking during the break, there was a whole bunch of other information. I'm thinking we should have had the bikes on. But you were talking about something having to do with cancer treatment.
Right. We have 3 certified lymphedema therapists on our staff, and they're a rare bird to have. We have 3 of them. And lymphedema is very, very common in cancer-related diagnoses. Primarily, you'll see it with breast cancer survivors. What happens is when the lymph nodes are damaged or removed, your system no longer takes care of the swelling, and you have edema. And so the treatment is lymphedema treatment. And we have a nice room that's kind of been painted, really pretty colors. We've got some beautiful photographs in there. It's a quiet, private room. And we are able to provide lymphedema treatment in the McGrane. And we also provide that same kind of treatment at the Post Falls Cancer Center on Tuesday and Thursdays for a couple hours to meet those patients' needs if they're seeing doctors or having treatment in Post Falls.
And do you know what that involves?
It involves a clear evaluation and initial measurements of the swelling, and it involves a special type of massage, and it's followed by wrapping.
Oh, okay.
And then toward the end, the goal is to get the swelling down with the massage and the wrapping. Then you're issued a garment that you wear on your arm or on your leg to keep the swelling down. And you might also be issued a compression pump that actively pumps that fluid out of your body. So the process is to get rid of the edema so that you don't get wounds and sores that don't heal. And then either you use a garment, like a sock or a sleeve, or a pressure pump to keep that material out.
So because it is a massage and wraps and stuff like that, it's done privately so no one else can see.
Absolutely.
Okay.
Yeah, privately and in a fairly quiet area with a radio. Yeah, it's really pretty.
Nice, serene atmosphere.
We try.
And one of the other things we were talking about was the occupational therapy.
Right.
I know when someone has had a stroke or has had some sort of injury, that oftentimes when they do come back home, they need to relearn how to do things because maybe one side of the body is paralyzed or they can't stand for long periods of time or things like that. And so that's when occupational therapy would come in, and you have a whole setup there for someone to relearn how to do things, correct?
Right. With any kind of neurological injury, both physical therapy, occupational therapy, and speech therapy join as a team to work with the individual. The occupational therapist focuses mainly on what we call activities of daily living, bathing, cooking, light housework, eating, money management, driving, and being safe in all those activities. They also work quite a bit on the arm and the fingers and the hand, dexterity. Physical therapy works on the walking, the balance, the leg strength, transferring, getting from a wheelchair to another chair. And then speech therapy, of course, works on not only articulation, but memory. And then if there's any swallowing issues, we don't want people swallowing if they don't have the right coordination of the muscles. So as a team, we work with the neurological patients, and we have quite a few kind of areas in the building that help them with that. We've got a therapy kitchen where they're able to prepare a light meal, cook a light meal. We've got a clothes dryer and washer. We've got a dishwasher. So they're able to simulate some of their activities of daily living there. We've got a therapy bathroom where they can practice the showering and that kind of activity. We've got the large hallway that we work on the balance and the walking with. And then speech therapy has quite a bit of equipment that they can help the individuals with, whether it's cognitive memory or swallowing or talking. So we've got a lot of areas that we can actually simulate the activity.
And in talking about my friend who was relearning to walk, that was one of the things he had to relearn how to do, was to eat and to swallow and to talk. And you don't think about those things when, someone has had a stroke or someone has had an injury, but those things need to be relearned again.
They need to be relearned. They need to be given strategies if it's not coming back fast enough, or if it's not going to come back 100%. There's always ways you can compensate, and that's the therapist's job, is to say, excuse me, if you can't do this, let's try a splint, or let's try to use the other side, or let's make your liquids a little thicker. So it's our job to help them reach their potential, but in the meantime, give them strategies to bridge across so their frustration is a lot lower and they can have some independence.
Because that's really the main point, is you want someone, if they can't come back as strong as they were, to be at least as strong as they could be.
Absolutely. And the patient has to identify what that is, because you didn't know them before the injury. So one of the things that we all do early on the first visit and then throughout is ask them what they hope to accomplish. We have realistic conversations with them, but throughout the treatment session, there's always that question of, how are things going at home? What can't you do? What are stumbling blocks for you? What do you think will help you with that? Let me have you try this piece of equipment. Because every minute you spend with the patient is really, they're doing the work, so it's got to gain them something in the end.
And one of the things I know that's over there that I've had lots of discussions with families about is the driving program.
Right.
Now, I know that requires a letter from the doctor, a referral from a doctor.
Absolutely, because most of those evaluations are through the Medicare insurance product, and Medicare does require the doctor to be the one that starts the therapy or the testing.
So resolve the mystery about this. It's not that your doctor's going to give you this and they're immediately going to take away your driver's license. I mean, there's a whole process over there that you all do. It's not just throwing someone in a car and having them drive, and it's someone's own personal opinion if they can drive or not. There's a whole process that goes on.
Right. The referrals come from doctors that have concerns, from family members who have concerns, from law enforcement that have seen somebody break the rule and they have concerns. They'll call down to Boise. They'll come from the individual themselves who's had a change in their status. So there's a lot of people coming in for driver's evaluations for various reasons. What we do in the clinic, what the occupational therapist does in the clinic before she takes them out into the car, is some cognitive testing, some memory testing, some visual testing, making sure they can see, peripherally. She also does some timing testing to make sure that if they need to brake, the reaction from the brake sign to their foot is adequate.
And that's actually a subjective timing. Objective.
Yes.
That it's not just her opinion,
No.
it's timed.
Right.
And
there's some normative data. All
Right.
those tests that she does, she compares to a normative data bank, and will say at this age, with this gender, this is what this reaction time should be, this is what the strength should be. And then she makes a determination at that point, do we need to continue with the in-vehicle testing at that point? And then if she does continue with the in-vehicle testing, we have a car that's adapted, and it's not and you can drive it as a normal car also, but it has a passenger brake, right? She has her own brake.
I have one of those. It's invisible, but I have one of those.
But they can also use their own car, because for a lot of people, especially some of the older folks, they're very familiar with their car. They know how to see out the window. They know what the backup looks like. And you put them in a new car, and they may fail just because they don't know the car, and that's not fair. So they can choose to drive their own car. They can choose to use our car. She takes them on a planned route. And a lot of times what she'll do is take them to a familiar area. So if that individual only drives from their trailer to the store and to the bank and back home, and they only drive during the daylight, then that's what she'll test them. She'll make recommendations, and on the license you can have those special recommendations, daylight only, in town only, and those are ways we can keep the independence with the individual, but not put them in a situation where they're going to get lost or be unsafe. And if they fail, if they go out and they don't enter into a freeway at the appropriate speed, if they become a hazard, or if they're not looking both directions or running over curbs, then she makes a pretty clear report to whoever referred that individual, and does have that conversation with the individual that you need to look at other opportunities. Driving is not going to be safe for you.
And we've always pointed out that you may think yourself you're safe to, drive, and your family may not. And the point is, go and at least get evaluated, because then you have a baseline.
Absolutely. The baseline is very, very important, because things do change over a year, both if you improve from an injury or if you're declining. And a lot of times that will be one of the recommendations, is retest in a year. Now, there is a skills tester through the DMV that can do skills testing in a car. And sometimes that's all they need. But a lot of times they need to have the other information about their reaction time and their memory, so we don't have people driving to the store and not remembering where they're going.
How to get back, right. And that is really important, because if you yourself are concerned about, am I losing my ability to drive, why not see where you are? And if it's good, then you have confidence in yourself that you're okay to drive. It's the not knowing, I think, that really bothers you. Am I safe or am I not safe?
Right. I think an insightful person would be thinking that way. I think what we've seen is it's a huge freedom to take away. It's a huge fear of older folks. And what we have to do is provide information, let them know what we're seeing, let them know that if they are okay, daylight only, short distance only, they haven't lost everything. But then provide them with opportunities. How else can you get around the community? So we're not taking away their access to the community. So it's a conversation.
And it's a big thing, like you said, because I remember when I got my driver's license when I was 16 years old. That was a big deal. And now I've had my driver's license for, 60, 70 years, and you're going to take it away from me?
Right.
That's not a real easy conversation to have with somebody.
I think the fact that that Kootenai has a van allows people to not panic so much about their doctor's appointments, because this van service also takes you to your doctor's appointments. But I think a lot of times that's a lot of what they do, and when you can't drive, then that's another fear, that they can't get to see their doctor, they can't get their other medical things taken care of. And so we just have to have the conversation. And again, like I said, provide them with other opportunities if it's not going to happen.
And we're very lucky in that the community that we live in here has a lot of different options. We've got taxi services, we've got bus services, we've got the van through the hospital. It's not like you're stuck somewhere that doesn't have other options.
Right. It's much better in a bigger city, of course, but there are options, and I think people don't know a lot about the options. So that's one of the conversation pieces we have early on, is don't panic. There's other ways you can get around. And in a lot of cases, the family's more than willing to help. They're just... they don't quite know how to have the conversation with the mom or the dad. But once that decision's made, there's plenty of people who, church friends, neighbors. There's a lot of people in the community that would be willing to take you wherever you have to go.
Absolutely. So after they take this test, a written report is then given to
the doctor. Right. And, of course, the patient gets a copy of it if they want.
And the occupational therapist cannot take their driver's license away.
That is a physician decision. They contact the main office in Boise regarding that.
And so it would have to be your doctor that makes that decision.
Right.
So it's not, I'm afraid if I go there, they're going to take it away from me because I'm taking this test. That's not the case.
No.
And you mentioned the van service at Kootenai. For any doctor's appointments associated with Kootenai Health System, this van service is available?
Yeah, there's probably some rules I'm not aware of. I know that there's some geographical limits as to how far they're going to travel to pick you up. And then as far as who they bring you to, my understanding is a physician's office or KMC Physical Therapy, the rehab services. As far as which physician offices, I'm not sure.
So you really need to check, because you might have that option.
Right. Oh, yeah, absolutely. That is a wonderful option. And they have wheelchair lifts and very caring drivers, very skilled drivers.
And you had mentioned that if they have a caregiver, the caregiver can ride with them.
Absolutely. Absolutely. The caregiver is encouraged to be there all the time.
Well, we're going to continue talking about the McGrane Center because there's like I said, so many things that the center provides to the community. And just knowing that it's there can help you. So we're going to take a break, and we will be right back. You okay?
Mm-hmm. Yeah. Getting a little.
Yeah, I know.
I'm good, thank you. I just
I lost my voice about a month and a half ago.
Oh my gosh.
Oh, and it was really hard. And you could tell when you listened to the show that I was.
yeah, I think I'm deeper than I usually am. But and as soon as you know you're gonna cough, then you panic.
So tell me on our last segment where you would like for me to head.
I think that there's a couple things that I like to brag about at the McGrane. One is the 0 to 100, right? That we see anybody.
Okay.
One is that we are not a specialty orthopedic clinic. We see anybody who needs rehabilitation, whether you're in a wheelchair, you have a wound that needs to be taken care of. So we have a widespread talent. A lot of our therapists have been there 15 to 20 years longer, so I'd like to talk about that, just the longevity of our therapy staff. We probably have 25 therapists in that building. So the continuum, the fact that we have a lot of therapists, a lot of talented therapists, there's not a diagnosis that we probably haven't seen. And then we do a couple things. We are one of the few clinics that really offer 45 minutes direct one-on-one with a skilled licensed person. I don't want to say other clinics have aides treat you, but they do. Okay. But all I can say is we're one of the few clinics that when you're in that gym, you're with a licensed therapist for that amount of time, and you won't have treatment done by an aide.
Okay.
And we measure customer satisfaction, and we measure what are called clinical outcomes. How well do we do with somebody who walks in the door? And we measure ourselves against clinics, 1,500 other clinics in America. So if it takes us 8 sessions to get your neck better, what are the other people doing? They're doing it in 6. We find out why. What we found is we're right there with them and sometimes better. So we're as efficient and sometimes better than clinics, the other 1,500 clinics that we compare ourselves to when it comes to most diagnoses. So we're always asking ourselves, are we doing the best? We may think we're really good therapists, but now we measure our outcomes. And so outcome measurement, customer satisfaction, huge age group, lots of talent, lots of people, and the one-on-one with skilled.
Okay. Okay, you ready to start back?
Yeah.
And welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Paula Taylor with the McGrane Center. I'll just say McGrane Center. And the McGrane Center is located behind Kootenai Medical Center in that separate building towards the highway.
Correct. It's north of the main blue building. Right now there's a brick building that's 3 stories high, which is the business services building. Just north of that is a 1-story brick building with an obvious swimming pool inside and blue tiles, and that is the McGrane Center.
And what are the times that the McGrane Center is open?
We are open Monday through Friday, 7 to 5:30.
And there's some things inside that building that you're not going to really find anywhere else around here. One of them being the adult day.
Absolutely.
Which is really fantastic, especially if you're caring for someone with any kind of dementia issues and you need some respite to be by yourself, to go to the store, to do whatever you want. That adult day is so important. And again, long-term care insurance will pay for it, and there are veterans benefits that will pay for it. There is the rehabilitation pool that's over there. That 92 degrees on a winter's day is wonderful, trust me. And if you're having issues moving around and exercising your muscles and joints, that is a great place. They've also got the driving program. You're not going to find that anywhere around here when you're trying to deal with a loved one who you have issues with them driving and for their safety or the community's safety. So those are some things that are very particular to the McGrane Center that you really do need to know that those resources are there. But there's some other things over there that you're very proud of, Paula, and why don't you tell me about those?
Right. We're the only clinic that offers all three disciplines: speech, occupational, and physical therapy, and that's critically important to a lot of people who have deficits in all three of those areas. We have the ability to treat any age group, and we've got skilled folks. Our pediatric folks only treat pediatrics. Our adult folks only treat adults. We've got probably 25 therapists in that building, combined PT, speech. That's a large group of therapists. Many of our therapists have been there longer than 8 years. That says a lot about Kootenai Health and a lot about our experience. We see a lot of different diagnoses. We're not a specialized clinic for orthopedic only or post-surgical knee only. We see neurological patients, we see wound care patients, we see cancer patients, we see sports med and orthopedic patients. We see quite a few industrially injured patients. We've got a very strong program there. We do provide, and we're one of the rare clinics that provides direct care for 45 minutes or 30 minutes only with a licensed therapist. So if you see somebody for therapy at the McGrane Center, it'll be a licensed therapist. An aide or an athletic trainer will not be treating you. It'll be a licensed, certified therapist. The other thing that we do 2 measurements on how we are performing our job. We have customer satisfaction ratings that we're held accountable to, and we compare ourselves not just within our group but throughout the United States. And the other thing we compare is our clinical outcomes, and that is a measure of how efficiently you get somebody better. And the idea, of course, is that you don't keep them forever, but you keep them for the right amount of visits over the right amount of duration to help them meet their goals. We compare how we do that with 1,500 other clinics in America, and we measure whether or not we're getting people with the same diagnosis and the same presentation better as fast as they do, or slower or quicker. And what we find is that we're very, very close to averaging with the other clinics, or we're above. So we actually get people better a little bit faster than most of the clinics in the United States with our care. And that's a nice thing to know.
What I think is really neat is if you're going through having some sort of physical therapy, either in the water or in the gym, and you're doing it and you're getting better, and now your insurance has run out and you no longer can have the physical therapy, you can still go and do those exercises on the same equipment, doing the exact same things that you were doing before, which is really important for your continued health.
Absolutely. That is always a goal. In any time we sit down with our patients, they'll have goals about walking better, faster, reaching higher, but always in that goal group is independent with an exercise program, whether it's at home or in the building, because it's what you do day in and day out that gets you where you want to go. We're simply there for a very short period early on to teach them how to do it safely, teach their care provider how to do it safely, advance them when they're ready. But we're not going to be there all their lives, and so they need to find a way to be successful, and the fact that they can come in as a community member is a benefit that we have to offer.
And I was just totally amazed when you were telling me about the pediatrics, because I really, being wrapped up in the senior world as much as I am, I really didn't even think that far, which was probably very narrow-minded of me. But you have a gym for the children, and you have programs in the pool for the children.
Absolutely, and some of our therapists actually work in the school district, the Coeur d'Alene School District, the Lakeland School District. So some of our staff actually goes out and does the physical therapy in the schools, and other members of our staff will do the physical therapy, occupational therapy, speech therapy in the clinic. So we're able to kind of cover both needs for the families out there.
So if there's any need that you have, and again, like I said, there's things in this building that are going to help you.
Absolutely.
And if you're especially if you're dealing with a loved one who is having difficulty moving, you can take them to the pool to do exercises. If they're in a wheelchair, they're not restricted from going into the pool. And there's rooms there that you can help them to get ready to go in there. You can go in the pool with them if you're afraid.
At no charge. If you're a caregiver, you can attend the pool without being charged because you're going to be there helping them.
Right. And if there's issues with driving, there's a place to go to either confirm your suspicions or relieve you. And if you're caring for somebody that has dementia or has some issues, that adult day is just so really neat. I've been in there, and the people are always active doing something.
It's a very nice program.
And I've even heard of people talking about that they've had a loved one who doesn't want to go in there, doesn't think they need to go in there. And so what they do is tell them, well, you're going to go in and volunteer. You're going to volunteer to help. And they go in there and they start with the activities, and next thing you know, they're looking forward to going.
Right. I don't see anybody refusing. They're all pretty pleased to be going in there doing what they do.
And the staff is just so very caring. I've watched them.
They're amazing.
With the seniors. Well, if someone wanted more information on any of these programs, again, I know in the beginning you gave out some numbers, but give out some numbers as to how they could find out more information or schedule some of these activities.
KootenaiHealth.org is our website, and all of these programs are listed on that website, and the phone numbers are there. The pool schedule is there. You can also call for the pool, 666-3858. For the adult day program, 666-2728. And for any needs when it comes to outpatient rehabilitation, whether it's physical therapy, occupational therapy, or speech therapy, that number is 666-2950.
And if they want the driving program, talk to your doctor.
Right.
All the doctor has to do is write a referral for it, and they'll get it scheduled for you.
Right.
It's very important, very important. Well, thank you for being with me this afternoon.
You're welcome.
It's a lot of really good information, and sometimes I have folks in here and I think, okay, I know about their program. I know all about, what they do. And they always hit me with something I didn't know. So it's really, really kind of fun. Thank you.
Thank you.
And thank you for listening to this Senior Moment, and you all have a wonderful rest of your afternoon. Good day.